3, 4, 5. Okay. Welcome to today's session on moderate to severe asthma by Apollo Cradle and Children's Hospital. To speak on the topic, we would like to welcome Dr. Ravi Kyadagiri, our in-house consultant for pediatrics and neonatology. He has done his MBBS, MD and fellowship in neonatology. We welcome you, Doctor. You can now take over the session.
Okay. Thank you. Thank you for the nice words. So today we will be having um, a little bit study about the moderate to severe asthma, basically asthma and its severity uh, in the following headings. So basically, first, what is asthma? What is what causes asthma? And what are the triggering factors for asthma? And how to treat asthma? Uh, so under these headings, we will be discussing today about asthma. Asthma is one of the allergic conditions that affects uh, both adults and children, but more and more children are suffers from asthma. So nearly 1 in 10 children all over the world who suffer from asthma belong to India. Okay, so asthma is one of the important childhood diseases, and it causes majority terms is called morbidity. That is, it affects the various function of the child, like scholastic performance, and it affects the involvement of the child in the sports activities and any exertional activities. So it is very important to understand regarding asthma. So what is asthma? Asthma is a hyperreactive airway disease. Is also called as hyperreactive airway disease. So here there is a hyper responsiveness of the airways, which causes the not getting sufficient oxygenation to the body. So it's basically, as we are aware, we have a respiratory uh, passages, so which are just like a uh, which are made up of a lot of smooth muscles. So it is just like a round hollow pipe. So this pipe is made up of lot of uh, smooth muscles. So whenever one child suffers from asthma, the diameter of this tube is going to get narrowed. So in the severe asthma, it is somewhere between 30% to 50%, whereas in severe asthma, the narrowing can be up to 75 to 80%. So what are the triggering factors that causes the asthma? The triggering factor that affects the children are the pollens, industrial gases, and chemicals. These body odor sprays, the traditional method of cooking, like using of uh, these chullas, so that produces lot of smoke, so which acts as a triggering agent for the asthma. So one more factor that increases the chances of asthma is exercise. However, so this is a one thing that we have to modify, and slowly adopt. uh, that doesn't mean that children should totally avoid the exercise. We have to slowly modify this triggering factor, and we should overcome by using medications and other means. So these are the factors that contribute to the that that triggers the asthma is these viral illnesses. So many of the viral illnesses, especially the respiratory virus illnesses like flu, the most important is flu infection, and other respiratory. One more is a respiratory syncytial virus, especially in the preterm babies, RSV and flu, both common flu and swine flu. So both these increases that triggers the asthma in the children. So next is understanding what are the symptoms of asthma. The symptoms of asthma are cough, shortness of breath, chest tightness, unusual quietness in the child, or very irritable, not able to console the child. Okay, these are the symptoms of the asthma. So on clinical examination, what we find is the child is struggle to breathe. Okay, so it's called breathing difficulty. And on auscultation with a stethoscope, if we hear, we hear wheezing sounds. Okay, so basically asthma is a clinical diagnosis. So absolutely assess the severity of the asthma. So we do certain investigations. So the investigation could be a simple complete blood count, which helps us, to know whether there is an allergic component is involved, or is there an infection background in the child which is triggering the asthma. It helps to treat the asthma rather than diagnose the asthma. So another investigation that we do is chest X-ray, which is basically again to know the severity of the asthma rather than diagnosing the asthma. So next, coming to the part of uh, treatment of asthma. So treatment of asthma involves multi 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 level of treatment approaches. So basically, there are two types of treatment. One is the drug which relieves the spasm of the respiratory passage. So these are called relievers. So second one is called preventers. Okay, the relievers basically what they do is, so they they relieve the narrowed part of the respiratory passage. So it will helps in the dilatation of this relaxation of the smooth muscle, and helps in maintaining the diameter of the respiratory passage. Okay, so these drugs are basically other variety of the drugs depending on the duration of the drug. We use a both short acting uh, uh, short acting relievers and the long acting relievers. So the second component in this treatment is the preventers, okay, or which relieves the triggering factors. They are basically a corticosteroids. Okay, we use steroids. So the beauty of the modern medicine is here the steroid that we use is inhalation steroids. So in moderate asthma, so we use a inhalation steroids. So where the drug will be directly delivered to the site of action. The site of action here is the lungs or the alveoli for that matter, to be precise. Okay, so the drug will be delivered directly to the respiratory system. So it helps in the prevention of this inflammation. So basically what happens, the triggering factor is, so any of the triggering factor which leads to the inflammation in the alveoli, in the respiratory passage, so that will leads to the narrowing of the passage. So what this and corticosteroid does is, so they basically uh, basically they prevent the inflammation formation and helps in preventing the collapse of the respiratory passage. Okay, so again, so we especially we use it for 6 weeks, 8 weeks, 10 weeks. These inhalations. Okay, so that will provide a long-term relief to the child. So other set of drugs that we use usually in the hospital setup, especially for the severe asthma, are the injections, corticosteroids in the form of injection or oral drugs. Oral drugs will be used in moderate asthma, whereas in severe asthma we use a injection drugs to give a immediate relief to the child. Okay. Next is we touch upon what are the preventive measures that we can undertake so that the child can be relieved of these symptoms. Before that, I'll touch upon exercise and asthma. It's one of the important topic. So many parents will be interested to know. So whenever the child is exposed to exercise, my child is going to get a asthma. So no doubt the asthma that exercise is a triggering factor for the asthma, and along with exercise, the cold weather is going to precipitate the asthma. So that's the reason we should ensure that the child goes out or does exercise in a little warm environment compared to the cold environment, and the inhaler pumps with the child, and the child should adopt to the exercise gradually. Okay, for example, if he is running, so let him start with 100 meters or 200 meters. So gradually we should enhance the lung capacity of the child, and we should encourage the child to participate in the exercise, and even in the school, outside the always carry the drug with the child. And in the west uh, there is a scholastic program for the uh, scholastic program for the uh, training. They do train the teachers regarding the ill effects of the asthma and how to overcome if it happens in the school premises. So on an average in a classroom of 20 20 to 30, there will be one or two kids will have the asthma issues. So that's the reason the asthma attack can occur anytime. So that it is very important for the even not only the caregivers, not only for the parents, even the teachers should be aware of the asthma triggering events and how to overcome them, how to overcome the asthma. So that has to be taught to the even to the teacher. So next is what are the precautionary or preventive measures that one has to take to overcome the asthma. As I mentioned, one of the triggering factor in asthma is the flu infection. Okay, influenza vaccination. All these high risk kids should receive every day, every year mandatory flu vaccination till the age of 10 years minimum. Okay, usually the asthma triggering will reduce as the child grows. So usually it will reduce significant level beyond 10 years of age. So that's the reason it is mandatory to give all these kids flu vaccination. Apart from that, we should ensure that what are the triggering factors that are there at home, like dampness, okay, the bed bugs, and we should ensure the proper washing and drying of the bed sheets, pillow covers, and preferably we should use the cotton bed sheets and got cotton bedspreaders and cotton pillows and clothing. We should avoid. We should use cotton cloths as much as possible, and you should avoid the use of the traditional method of cooking. Cooking like these chulas and other things that will reduce the Apart from this, We should ensure the child regularly does some kind of a yoga, breathing exercise, especially breathing methods that will increase the lung capacity of the child. So that these are the methods that we can prevent the asthma. So this is the topic for the day. Okay, so if any of you have any queries regarding this, you can always ask our coordinator. I'm going to answer them one by one. Internet, how to differentiate the symptoms of moderate to severe asthma? So moderate to, in moderate asthma, uh, the in severe asthma, first I'll tell, the child will be very silent, and if it finds difficult to continue, even complete a single sentence also. That is a sign that the child is having a severe asthma. Moderate asthma, usually the predominant symptom is a cough. A cough is a predominant symptom, and child will be able to complete the sentence with little difficulty. Okay, so this is the main clinical differentiation that parents has to understand. So far as clinical assessment is concerned, in severe asthma, breath sounds in the with the stethoscope, and there may be little drop in the oxygen saturation, moderate, mild to moderate drop in the oxygen saturation, that we classify as a severe asthma. What happens if you uncontrolled asthma? Uncontrolled asthma can lead to a lot of devastating effects on the child. Usually, it's basically a chronic condition, so that will lead to the poor scholastic performance and poor participation of the child in the school outdoor activities. Can weather change trigger asthma? Yes, definitely. The cold weather is one of the triggering factor for the asthma. So as I said, whenever we are exposing a child for the activities, outdoor activities, weather should be preferably warm. Can asthma medication help prevent asthma? Definitely. The preventers, as I mentioned already, so the basic fundamental preventers are the inhaled corticosteroids. So we titrate the corticosteroids based on the weight of the child, and responsive of the corticosteroids to the asthma. It is individualized. We usually prescribe for 4 to 6 weeks, 8 weeks, depending on the child condition. Usually the pregnancy the in the pregnancy, because of the various hormonal influence, the smooth muscle relaxation is the predominant thing. So the asthma triggers are less common compared to non-pregnant woman. Pregnant woman will face a less severe asthma compared to a non-pregnant woman. However, the regular medications can be controlled, so there is no harm in control using the regular medicines. However, it is better to consult your physician before proceeding with any medications. I have heard being overweight can cause asthma. Is that true? Yes. So one of the triggering factor for asthma is the overweight, also obesity. So reducing the weight will optimize the lung capacity and helps in preventing the asthma, severe asthma, and asthma attacks. My mouth get dry after my asthma medicines from the breathing through my mouth from the stuffy nose. Will that cause problems? Yes. Whenever we use these medications, so these are beta agonists, so they tend to cause a little dry mouth. So after each inhalation of the drug, so ideally, if the child is able to do a gargling, so you should do a gargling with a warm water, or else we should give. Okay. So if you have any queries, you can always post in our Facebook page. So as much as possible, we will try to address the issues. Okay. Thank you very much for the patient hearing. I thank Apollo Cradle for giving me an opportunity to speak on this topic. So, if anyone have any queries regarding their children, you can always drop into Apollo Cradle Children Hospital. Thank you very much. Thank you, coordinator, for coordinating the session.